almost 15% of the population have chronic kidney disease. After 40, kidney functions start to decline importantly. That is why it is important to notice kidney problems earliest to treat and maintain normal kidney function throughout life. Kidneys act as a natural filter in our body, and they remove excess waste from the blood. These excess products are, for example, urea, which is the main product of protein metabolism, and urobilin, which gives urine its yellow color.
The first and most critical sign of kidney problems is an elevated creatinine level. Our muscles require fuel for energy, and they use glucose as well as creatine as an energy source. After the breakdown of creatine, we get creatinine, which is filtered by the kidney. When the creatinine level is increased, it indicates that the kidney is not functioning properly and is unable to clear creatinine. Normal creatinine is from 53 to 106 micromoles per liter, and a higher level means impaired kidney function. Where people who have a higher muscle mass or are dehydrated can have elevated creatinine even with normal kidney function.
The most common disease that causes increased creatinine is chronic kidney disease, usually associated with diabetes. In this case, creatinine increases gradually. Another common cause of high creatinine is severe infections, shock, or exposure to toxins. In this case, kidney function deteriorates significantly and rapidly. The second common sign of kidney problems is foamy urine. It means that proteins are present in the urine, which should not normally be the case, or they should be made. In the case of kidney diseases like nephrotic syndrome, diabetic nephropathy, or urinary tract infections, foamy urine is observed. On the other hand, dehydration or phospholipid urination can also cause foamy urine, but it does not indicate kidney problems. The third common sign is nocturnal frequent urination.
Normally, a person should urinate once at night. For the older population, urinating 2 times per night is normal. However, if it occurs more than 2 times, it is considered frequent nighttime urination and is a sign of kidney problems. Most commonly, this happens during chronic kidney disease, when kidneys gradually lose their ability to concentrate urine effectively and more diluted urine is produced, which increases the frequency of urination. Also, diabetes can cause nighttime urination because high blood sugar causes osmotic diuresis, increased urine production, which contributes to nocturia. Also, urinary tract infections can cause nighttime urination. The fourth most common sign is mild swelling around the eyes, hands, or ankles. Kidney-related edema often shows up as a symmetric, puffy appearance, especially around the eyes. This happens because when the kidneys are not removing extra fluid efficiently, the body retains water evenly.
The swelling tends to be persistent rather than disappearing completely. For example, if you wake up with puffiness around the eyes and it does not fully resolve during the day, it could be a sign of kidney-related fluid retention. If mild puffiness is a consistent family trait and you do not have other symptoms like changes in urine, high blood pressure, or fatigue, it is less likely to be due to kidney problems. Also, allergy or sinusitis can cause puffy eyes, and it does not mean kidney problems. The fifth important early warning sign is high blood pressure. High blood pressure can damage the delicate blood vessels in your kidneys over time, impairing their filtering ability. It is not just a side effect, it actively contributes to chronic kidney disease. If you want to protect your kidneys, your blood pressure should maintain less than 130/80 millimeter mercury.
The indictment of kidney damage does not happen overnight, and in many cases, 5-10 years of uncontrolled high blood pressure can start to cause noticeable kidney impairment. The sixth is mild back or flank pain. Kidney pain typically occurs in the flank area, the region on either side of your lower back, just under the ribs. Kidney-related discomfort is often described as a dull aching pain, which can sometimes become sharp if there is an acute condition like a kidney stone. Mild, persistent pain in the flank might suggest early inflammation or stress on the kidneys. such as from a low-grade infection or the beginning stages of chronic kidney disease. Cloudy urine is another sign of kidney problems, but not universally. Cloudiness is often seen when there is an infection, such as a urinary tract infection or even a kidney infection, pyelonephritis. In these cases, the cloudiness might be due to the presence of white blood cells, pus, or bacteria.
Crystals or sediments sometimes occur when minerals or crystals like calcium in the urine give it a cloudy appearance. This might occur in cases of kidney stones or metabolic issues. And blood in the urine is another sign. If blood is coming from the tiny blood vessels in the kidneys, as seen in conditions like glomerulonephritis, the urine can appear pink, red, or cola colored. Also, severe infections or injuries to the urinary system or just cystitis can cause blood to appear in the urine. And at last, when there is suspicion of kidney problems, we use several standardized tests to detect kidney function and health. The first test is a blood test that measures creatinine, a waste product produced by muscle metabolism. The second test is the estimated glomerular filtration rate. It is calculated from your serum creatinine along with factors like age, sex, and race. It gives a good estimate of how well your kidneys are filtering blood. Lower EGFR values indicate impaired kidney function. Kidney function is commonly classified into stages, from stage 1 to stage 5, based on the estimated glomerular filtration rate. This staging helps in assessing the severity of kidney impairment and guiding treatment decisions.
The third test is blood urea nitrogen. The BUN test measures the amount of urea nitrogen in the blood. Urea is a waste product from the breakdown of proteins, and like creatinine, higher BUN levels can be a sign that your kidneys are not efficiently filtering waste. The fourth test is the urine albumin to creatinine ratio. This test checks for albumin, a type of protein in your urine. Normally, very little protein is lost in urine, and a high ratio suggests early kidney damage, as the kidneys start to leak protein into the urine. And the fifth test is renal ultrasound. Although not a blood urine test, an ultrasound provides images of the kidneys. It can reveal structural abnormalities, obstructions, or changes in kidney size, helping to give a complete picture of kidney health.